stem cell research, getting rid of this hairline, okay? We're gonna try to get rid of that. Look, I used to be able to have all of that. There was hair in there. Look, I'm 38 years old. I don't want to shave my head until I am 65 and I won't give a damn. Here's the thing, we got modern medicine. We got things out here today can keep us alive longer, data, AI. I got this app and this thing tells me my weight, skeletal muscle mass, body fat percentage. So I'm doing good. My health is good.
And how much do you know about stem cell therapy?
You're just gonna inject me in my forehead or something like that?
Stem cell therapy for hair has been more popular within the last 10 years. And we've been doing this for more than 9 years. I would say we are the experts in stem cell therapy for hair. So you've definitely come to the right place. What's your current hair routine?
I don't even know what the brand is. I think it's a woman's shampoo though.
Okay.
It's a purple bottle. Well, I'm just gonna throw that away and do whatever you tell me to do.
Okay.
Oh, okay, so those are the little baby hairs.
Yes.
Right there.
I'm gonna clean your scalp where we're doing the injection. So there's gonna be 5 syringes, okay?
Ooh-wee. That, ladies and gentlemen, it wasn't that bad. I mean, it hurt. I'm not gonna lie, it did hurt.
Hi, Trevor.
Hello.
I'm Dr. Yang. I'm a doctor in physical therapy and also a certified trichologist. So nice to meet you.
Nice to meet you.
Okay. So how can we help today?
Well, I've got some receding hairline going on here.
Okay.
Yeah, that I'm trying to get rid of so I don't look like my dad. I love my dad, but I'm not trying to look like him. You know what I mean?
I see that there's some genetic factors into it.
Yeah.
Okay. So, and how much do you know about stem cell therapy?
A little bit. So you're just gonna inject me in my forehead or something like that? And yeah, you tell me what.
Okay. All right. So, stem cell therapy for joints has been around for decades. It's been performed by physicians around the world.
Okay.
The stem cell therapy for hair has been more popular within the last 10 years.
Okay.
Okay. And we've been doing this for more than 9 years. So I would say we are the experts in stem cell therapy for hair. So you've definitely come to the right place.
Love it.
Okay. So the specific type of stem cells we use are called mesenchymal stem cells. They're known for their ability to regenerate and differentiate, meaning that doesn't matter where we inject or who it's coming from. Once we inject that into your body, it will know to regenerate or heal your own tissue.
So is that used just for specifically for hair, or you said also for joints too?
Yes, you could, but obviously at a different concentration. But it's the exact same type of stem cells.
Okay.
And we don't add anything else into our solution. It's simply stem cells and saline solution.
Where do you get the stem cells from?
Great question. We use donor stem cells. Okay, from the umbilical cord. Okay.
All right.
As you know, umbilical cords are considered medical waste after babies are born, but they're full of nutrients. So we work with a hospital and a lab that would retrieve the umbilical cords and extract the stem cells. Okay. So you might wonder, how safe are they? They're very safe because our lab uses an FDA-approved testing process to test all the stem cells that they extract to rule out all the diseases. Okay. So it's 100% safe and natural.
So there could be, if they didn't go through that process, there could be diseases in it?
Yes, because you don't know who it's coming from, right? Also, another thing, all our donors go through a medical screening to make sure that they are healthy enough to donate their umbilical cords.
Oh, okay. I heard that, can you not also like extract from a patient? Like where,
like from your own tissue?
Yeah.
Okay. Another great question. So have you heard of PRP?
Yeah, PRP.
Yes. So PRP is
like
where
blood?
they take your blood and it extracts your own platelets. Okay. And they inject your own platelets. So similar, yes, some places they do your own stem cells. The reason that it may or may not work as effectively is because when we lose hair, that's because our body is losing growth factors and, collagen, right? So imagine getting your own blood and stem cells. You're kind of recycling it from A to B, versus we use donor stem cells that are full of growth factors
So
and different types of collagen.
You already know that that's the good stuff.
Exactly. It's
so we
fresh
don't know
and new.
if you give mine, you don't know if it's good or not.
Yes.
Okay.
Yep. And also treatments like PRP is meant to be a maintenance treatment versus stem cell therapy.
Okay.
Okay. So if we determine that you're a good candidate and you go through the treatment, most likely you wouldn't need to come back.
Yeah.
Okay,
that was another question I had. So like how permanent, like, okay, so if we go through this process, we do the stem cell, how permanent is it?
Well, so I always say that nothing is permanent.
Yeah, I'm
unfortunately,
gonna
right?
go bald one day, right?
Well, no. Well, so with today's technology, you could keep your hair for a very long time.
Okay.
And so for our treatment, it's not just treatments, it's a program. Okay. So besides the injections that we'll be doing, we'll also be giving you a home regimen to follow. I always give this analogy. Say you go to a dentist, you get a dental procedure.
Like a cleaning.
And afterwards, the dentist tells you, okay, you have to brush your teeth every day now.
Floss.
So same thing, okay, with our program. During and after the treatment, you would need to do other things to help maintain the results, okay?
Okay.
So our whole body is all about maintenance, right? Can you imagine not brushing your teeth, not exercising, not eat?
What causes hair loss in the first place? I know I heard something like, is it DRT or what is
DHT?
DHT?
So
okay,
yes,
I got it messed up.
So there are different types of hair loss. Okay, so there's genetic, hormonal, there's inflammatory, there's nutritional. So it could be stress induced as well. Okay, but for men, I would say 90% of the time it's genetic.
Okay.
And the reason for that is you guys produce more testosterone, and DHT is a byproduct of testosterone. And DHT is studied to be the hormone that causes hair loss.
Right.
Okay. So in your home regimen, we would recommend a DHT blocker. But right now, I think we need to figure out whether you are a good candidate. In order to determine that, we would do a scalp analysis where we examine your scalp and your overall hair health to see how many viable hair follicles you have. And to determine whether it's a good hair follicle would mean that if we see tiny baby hairs, or we call vellus hairs.
So if there's still some life there, you'll be able to tell me if you can resurrect it.
Yes.
We need the resurrection power of Jesus in here today. Okay.
So, all right. So let's take a look. What's your current hair routine at home?
So I was shampoo and conditioner every day, but I'm learning that's might be causing the problem. Maybe that's too much. What do you think?
So most men have dry scalp.
Okay.
So it's actually good for you guys to wash your hair. I'm sorry. Most men have oily scalp.
Oily scalp.
So, yes. So
I was gonna ask you. I get shiny. It gets shiny up in here where it's gone. It's like shiny.
So that could be a variety of reasons. It could be that a certain product that you use, or your hormone imbalance. But if you do already washing your hair every day, then that's usually what we recommend.
Every day?
Yes.
Okay.
Yes.
I thought maybe like the shampoo and conditioner every day is too much stress on it. No?
No, not if you're using the right shampoo and conditioner.
Okay.
Yep.
So maybe that's it.
going back to the regimen I was talking about, we will also be including that.
Okay.
Yes.
So you're gonna hook me up with the good stuff.
Yeah.
Okay, because I'm using probably.
Yeah.
I've heard. Okay, can we get into some conspiracy real fast? I've heard. No, I've heard this stuff like I don't know if it's the pharmaceutical industry or whatever, but like some of these shampoo companies, they also are the same company that owns Rogaine and all the hair treatment company. So like, you might be washing your hair with some shampoo and it's falling out, and then they're getting you on Rogaine or whatever.
Yeah, could be. I mean,
Like they're the
I
same.
don't doubt it. Yeah, I don't doubt it. But when you shop for shampoo and conditioner, make sure you find products that are paraben-free and sulfate-free.
Okay.
Yeah.
Paraben
Paraben,
and sulfate.
sulfate. Yeah.
Okay. All right. Paraben and
Yeah,
sulfate.
because that would be damaging for your scalp and hair.
Okay. I have no idea. I think I'm using, I don't even know what the brand is. I think it's a woman's shampoo though.
Okay.
So that might.
Is it from a drugstore?
It's a purple bottle.
Okay. I mean, nowadays,
I don't know.
you know, people have realized that paraben and sulfate are bad for your hair.
Oh, okay.
So I think they would kind of note it on the bottle.
Oh, I don't know.
Yeah.
I don't know. I'll look.
You could.
Well, I'm just going to throw that away and do whatever you tell me to do.
Okay.
Oh, okay. So
Yeah.
those are the little baby hairs right there.
Yep. So this one shows kind of the different stages of your hair. Okay. So the thickest ones are your full-grown hair.
Right.
The thinner ones are your full-grown hair shrinking over time. So if you don't do anything about it, then the vellus hairs will gradually shrink down, and then eventually they'll fall off.
So you can basically, with the stem cell, we can turn these little things like that to looking like that.
Yeah.
Okay.
So we can give you more growth and also help with the thinning hair to be thicker. Okay. So once the vellus hairs fall off, those particular hair follicles will become dormant. Okay. And after they become dormant for a while, then they'll be completely dead. You know, there will be no blood supplies.
So what do you see? Do you see that I've got enough? Well,
let's see down here. So yeah, so usually our hairline is the first area to go.
Wow, look at that.
Yep. So I know you were mentioning about this corner, right? So in this picture, so there are some dormant hair follicles here.
Oh, those are dormant?
Yes.
Those can come back?
So
or they did?
With dormant hair follicles, the chance of them coming back is 50-50.
Got it.
Okay. Just because we don't know how long they've been dormant for.
Got it.
Okay. And in this area, if I have to guess, it's probably been a while.
Ugh, what's that?
Yes.
What's that nasty thing right there?
That?
Cancer.
I don't think so. This proscope magnifies your scalp by 200 times.
Yeah.
So you'll see everything,
Oh,
every little thing. So
what that is?
It could just be like a tiny, tiny mole.
Tiny mole.
All right, let's look at this side. Yep, same thing on this side. You have a decent amount of vellus hairs.
Now, does the stem cell, does that block the, what is it?
DHT?
DHT, does it do that? Or
no, so stem cell therapy itself helps bring some of the hair you've lost back. Okay.
What about natural ways? Because I'm not a big medication. I don't take any medication.
Well, good. So the DHT blockers are actually herbal supplements.
Oh, it's herbal supplement?
Yes.
Oh, snap.
Yeah. If you're into natural remedies, you've come to the right place.
Okay, yeah.
We don't do anything chemical here.
Yeah, I don't want that.
Okay. So yeah, so the front, as you can see, you also got quite a few vellus hairs. Okay?
Why does the skin look like that? Does my skin look healthy or not healthy? It's kind of pink and white.
It's a little bit shiny. I'm not sure if it's. Do you put product in your hair?
Yeah. Well, yeah, but I don't have any right now.
Okay.
No,
so it could be, sweat, or it could be oil. Yeah. Are you sweating?
No.
Okay. So maybe maybe you do have oily scalp.
I probably got oily scalp. I'm telling you, my forehead be getting shiny.
All right. So next, what I usually do is that I will take pictures and show you exactly where we could treat.
Okay.
All right. So now let's take some photos.
Yeah, it started, honestly, I think this started in my 20s, maybe 24, 25 years old. I actually started shaving my head back then. I would just shave it. I was like, I'm just gonna Bruce Willis. I'll do the Bruce Willis. Okay.
It seems like your left side is a little bit worse.
That's why I comb it over. I'm doing the comb over, y'all.
All right. So that was the last thing that we saw,
Oh
the
yeah.
crown, right? So it is starting.
Mm.
Okay. So I always say that the sooner you intervene, the best the results. Okay. You don't want to wait till most of your
Right.
hair follicles are dormant.
Yeah, no.
Yep.
We don't want that.
Yep. So we can definitely.
I mean, I even noticed like up in this area, you know, it's starting to thin. Like I
Mhm.
feel like it's just gonna this line is just gonna go like that.
Yeah, and
And then back and back, and this is gonna start going
then they'll
forward.
meet.
Yeah. Then this will be on the side.
Yeah.
Okay.
So that's a good thing that you're here seeking um,
Y-
assistance already.
Yeah.
Okay.
Okay.
So yeah,
Yeah,
we
like
can treat
even
this
like you
area.
could see right there, it's like,
Yep. Yeah, we can definitely treat this area. I know earlier you said you wanted this area,
uh-huh,
right? As we saw on the scalp analysis, there's the chance of you getting hair back here in this corner
50-50.
50-50.
Right.
Yeah. Again, because your hair and your hairlines usually the first part to go.
So I should have came in here at 25.
Yeah.
10 years ago or whatever, right? That's when I
But we
should
can
have.
still we can absolutely recover like this area
Okay.
and this area, and then same thing on this side.
Okay.
Okay. Yep. All right. So now that we've determined that you are a good candidate for stem cell therapy,
Because I still have some baby hairs in there.
yes,
Okay.
absolutely. So let's go over your treatment plan.
Okay.
Okay. It's typically a 3-treatment series where you would get 1 treatment every 4 to 6 weeks because that coincides with your hair growth cycle.
4 to 6 weeks.
Yes. So
Okay.
say that you're getting your first treatment today,
Okay.
and then you wait 4 to 6 weeks, and then get your second treatment, and then another 4 to 6 weeks. So usually after the treatments are completed, we would tell the patients to set up a follow-up appointment 9 months after.
Okay.
Any other questions?
Yeah. So you were talking about products that go along with it. So maintenance. Um,
So we will be including a hair loss shampoo,
okay.
hair loss conditioner,
Okay.
and then a DHT blocker, which is the herbal supplement.
Okay.
It contains saw palmetto seed oil and pumpkin seed oil that are natural DHT blockers.
Okay. What would you say I was also considering doing like transplant,
Okay.
right? You know, the difference between like when should somebody really be a candidate more for
Yeah.
transplant versus this?
Well, I can't speak for hair transplant because I'm not a hair transplant expert, but I can tell you that I would say hair transplant is probably the old standard. Okay, because it is a full-on surgery.
Right.
It takes 8 to 10 hours to perform, and you are awake.
Mm,
Okay, people think that they can just transfer hair from here to here, and that's it. I'll cover it. Um, each time you can only transfer so many grafts because you don't want to run into a problem called over harvesting,
mm,
right? Because you might end up losing more hair. Okay, and also with hair transplant, if your hair loss is genetic, yes, the area that they transfer the hair to might be long lasting, but the rest of your hair will keep shedding.
mm.
Okay. And also there's the price factor.
Right. It's a lot more expensive. I
Correct.
got a quote here in Frisco. It was like 15,000.
Yeah.
Um, everybody goes to Turkey because it's so expensive. They just go to
Yeah, but
Turkey.
I always say that it's a medical procedure or
Mhm.
medical surgery, right? If something goes wrong, you
Yeah.
might end up spending more.
Well,
And
there's horror stories of people that get botched up pretty good. So
we actually see quite a few patients after failed hair transplants.
right.
Yes. Sometimes people would get multiple hair transplants and still would see no results.
Mm. No,
Uh,
that would not
so,
be good.
not saying that hair transplants, wouldn't be a good solution for some people,
Sure.
right? I would say hair transplants.
I might still do it at some point. I don't know. I might still
Yeah.
I want to try this first. For me, I feel like this is more natural,
Non-invasive,
non-invasive.
yes.
Right.
0 downtime versus hair transplant.
Yeah, like I
You'll look
got
weird
a
for
date tonight. Okay, so I'm gonna
yeah,
come in here, get hooked
yeah,
up, and then
yeah,
I'm gonna go on a date.
yeah. So,
I couldn't do that with a transplant.
exactly.
I'd be looking crazy.
Yes. So, stem cells also has anti-inflammatory property.
Okay.
So, a few minutes after injections, you wouldn't even be able to tell that you just had injections.
Okay.
So there's zero downtime. You can go about your day right after.
Who's not a candidate?
For stem cell therapy,
Yeah.
good question. I would say someone who has active cancer
Mm.
or an active tumor.
Why would you? What's the reasoning for that?
Well, anytime you have cancer, you should not go through any type of procedure. So it's it would be a risk for us to take, and we
Mm.
always try to be safe,
Got it.
especially if this is a kind of a non-essential procedure.
Are there any potential side effects?
No, no. Again, going back to stem cells being natural and
Right.
anti-inflammatory, there's no side effect.
Okay.
Yeah.
That's cool.
Yeah, I would say the only possible side effect would be a skin infection,
Mm.
but that's if the provider does not prep your skin well or go through a sterile preparation. But it's knock on wood, it's never happened here.
Okay. What about I saw some things about guarantees and stuff like that.
Yeah.
I think I have a little pamphlet here. It said like guaranteed something. So it says most advanced technique, guaranteed hair growth. Talk to me
Yes.
about the guarantee.
Yes. So, right, the reason that we do a free consultation is to make sure that people we say yes to will see results.
So if you do a consultation with somebody and you're like, this isn't gonna work.
Yeah.
They're
Well-
the hair transplant. Because we can't help you.
Yeah.
So is this almost like, would you say this is almost like a hair transplant candidate? Like if you need a hair transplant, you're pretty well off. You're well gone. Like
No, so
no, not necessarily.
no.
Okay.
Usually I would say most of the time people who we don't consider good candidates are no longer good candidates for hair transplant as well.
I don't want to do a hair transplant.
Yeah.
I don't want to. Like I've seen the before and afters of that. I've seen it looks like it hurts. I don't want.
It does. I've heard a lot of horror stories.
I mean, you see people jacked up. It looks like it hurts. Anyway, so I don't really, I'm not excited about that. So when I saw this, it to me felt like a better option to just try to solve the problem at the root.
Yeah.
No pun intended. Tell me more.
Yeah. So when you're ready,
Hmm.
you can let us know, and then we can put you on our schedule.
Okay. I'm ready. I put on there, I checked the box. I'm ready.
Yes,
to
I
go.
see that. You're 100% committed.
Yeah, I'm ready to go. Like, because look, you only get one life and it's short. So
Exactly.
and I got a date tonight. So I'm hoping by the time I get there, it'll be back.
Yes.
You're like, no, just kidding.
Okay. Yes. We will go up front and talk to the front desk and get you scheduled.
Okay.
And take care of the payment.
Perfect.
Do you have any questions for me before we get started?
No, not really.
All right. So it's going to be 5 syringes, okay?
5 syringes.
Mm-hmm.
How many sticks?
About like 50.
50 sticks. Oh, geez. Oh, that's a needle in the back of the head. That's what that is. Is that one syringe?
Yeah, that was one.
Mm.
I'm going to angle the chair down a little
Mm.
bit so we can do the front.
Yes. That is a needle. Oh my gosh. Mm-hmm. Oh yeah. Oh shoot, yeah. Mm-hmm. Yes, sir. Feels great. I mean, it's doable. I'm doing it. So it's not a 10 for sure, but it's not a 1. It's like a 5.
And the last one.
Okay, last one. We're almost done. Mm.
Okay, you're all done. Just going to apply some pressure really quick.
All right. It wasn't that bad. I mean, it's over. Okay. I mean, it hurt like crap, but it's over. Like it was quick. That's what I like.
It goes by really fast. All right, after treatment instructions, you do not want to get your hair wet for 48 hours or
Okay.
put any products in it.
Okay.
If you were given minoxidil, don't use that until next Friday.
Okay.
No
Okay.
physical activity or anything that will cause you to sweat for 48 hours as well.
Oh, no working out.
No working out.
Okay. Dang, that's good to know because I was going to do that. All right. Is that it?
That's it.
Dang, we're a wrap. Yeah, you can stay. Oh, man, absolutely. You can see. Whoo-wee. That, ladies and gentlemen, it wasn't that bad. It really wasn't. I mean, look, I'm not gonna lie. It did hurt. I got needles stuck in me 50 times. She said 50, but I don't feel like it was really 50. Painful, sure, but quick. Holy smokes. She just did a little and then doom, 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 and we're done.